everyone, welcome to week 4. This finishes up chapter 30 for us, so our reading assignment is page 864 to 876. It's a lot of material to get through for us, so we're going to start right on up. So first of all, we're going to talk about some drug resources, and these are things that you can use to find information about a drug. These are the official ones. Really anything you find on drugs.com or etc. Aren't as official as the ones we're going to talk about. However, they can still be used to help you find information. But keep in mind, the best place to really learn about any drug is from the manufacturer's website or product insert. So there are a number of resources and reference books available that provide helpful information about particular drugs. These resources and reference books are updated periodically to provide the most current drug listing and information. Common resources include the Physician's Desk Reference, the U.S. Pharmacopoeia National Formulary, drug package inserts, nursing drug books, and drug-related websites. So the first one, the PDR, is published every year. It's also updated, I want to say quarterly. They're always sending out inserts that you can put into your PDR book to add to the information. It's also available online, and it's divided into color-coded sections. Table 30-5 lists those color-coded sections and what is in each one of them. The U.S. Pharmacopoeia National Drug Formulary is considered the official book of drug standards. Sorry, I'm trying to keep an eye on our new puppy who is being very, very mischievous lately, so we're going to put him right up in our lap. So the Pharmacopoeia National Formulary is published every 5 years and includes drugs that have been tested and certified that meet standards of quality, purity, and potency, often used by pharmaceutical companies, research laboratories, and companies that manufacture medical devices. Also occasionally used by providers, but I gotta tell you, I have never used one of these things. I've always had great references like LexiComp or Clinical Pharmacology or Micromedics available to me. And if you're working in any sort of healthcare setting, you'll probably have those available to you as well. Sorry, puppy. He's cranky tonight. So let's talk a little bit about medication preparation. Actually, medication preparation needs to occur in a well-lit area, as well as administration. You want to avoid becoming distracted while preparing medications, and additionally, you want to check your drugs to make certain they have not yet reached expiration date and have been stored correctly, and that they match what they say that you're about to give. So, for example, if you're going to give amiodarone, you want to make sure that your packet says amiodarone. Now, this is a theme that is going to come back again and again and again, the 7 rights of drug administration. And that is the right patient, right drug, right dose, right route, right time, and right documentation. So the right patient is verifying the patient's name with the chart and confirm it with the patient, as well as using their identifier, such as their date of birth or last 4 digits. You can also, some hospitals have barcode scanners that will scan their wristband, but you do always want to ask them their name and another identifier, such as their date of birth. Make sure you have the right drug. Check the label a minimum of 3 times to make sure it's the right drug and the right strength. Read the drug label when removing the medication, preparing the medication, and placing the medication back into the storage area. And that's to make sure that it gets put in the right place. Make sure that you have the right dose. If necessary, perform proper calculations to make sure that you have the right dose. And we're going to get to calculations in chapter, I thought it was 31, but I guess it's 32. The right route, then that means, are they taking it by IV, by mouth, or is it a topical? And you want to check the order to make sure it matches what you're about to give. The right time. This is usually not a factor in ambulatory health centers because drugs are normally administered at the time they are ordered, but always read the order for clarification. The right technique. Are you going to administer this IM injection correctly? When in doubt, always check the drug insert or ask the physician for clarification. Finally, the right documentation. If you didn't document it, you did not do it. So make sure you document it correctly. Everything we talked about. Who's the patient? Who's the drug? What's the dose? How did you give it? And what was the time that you gave it at? Safety and continuity in medication administration. PAD is an acronym that can be used during the drug administration process. It stands for preparation, administration, documentation, and that is a chain of events performed by only one person during medication administration. And there's that famous saying, if you didn't document it, you didn't do it. And this includes if you had a conversation with a provider, if you have had a conversation with another healthcare professional. If that conversation is important enough to have happened, such as clarification of an order or asking for more details, that needs to go into whatever documentation you were completing on that medication. So common reasons for medication errors include not reading a label carefully, confusing a drug with another that is spelled almost the same or sounds almost the same, not calculating dosages correctly, or trying to multitask while preparing a medication. And this is just a snapshot of things that could go wrong. Really, there are so many things that could go wrong, whether it's interruptions or distractions, or maybe you're overloaded with patients and understaffed. So really, that's just a small list, and keep in mind to always be vigilant as to how mistakes could happen and how you can prevent them. Hold on 1 second, puppy wants to come back up. Come here, puppy. Oh, fine. So if a medication error occurs, it does need to be reported. You need to recognize that the error has occurred. Remain calm. Don't say anything to the patient right in front of them that is going to, alarm them. If you have made a medication error, you can inform them certainly if you are sure it's an error and say, I think this is wrong. I want to double check it. Notify your physician right away. Assess the patient for any reaction. Take vital signs and look for signs of distress. And respond appropriately to whatever the physician orders. If he changes something or wants you to give something to help with a reaction. Document the error in the patient's chart and complete an incident report. Your healthcare facility may have different things that they want you to do on top of this, but this is the bare minimum. Now we're going to start talking about routes of administration, and this was the right route part of the 7 rights of administration, or 7 rights of drug administration. So enteral is anything pertaining to the alimentary canal or intestines. This includes oral, buccal, or some people say buccal, sublingual, rectal, and rectal routes. So these might be your tablets, your enemas, your dissolvable formulations, etc. The other option is to go parenteral. Anything that is not enteral is parenteral, and that is pertaining to beside or outside of the intestines. Topical, transdermal, mucosal, inhalation, injectable, and intravenous routes are all included here. So oral medications come in a variety of different forms. There are liquids, capsules, tablets, sublingual, buccal administration. There's a lot of different options when it comes to oral administration. Usually this has to go through all 4 parts of the administration, distribution, metabolism, excretion process. So there's no avoiding any of those. Let's see. You can look at table 30-6 for some examples of some solid oral medications. Keep in mind, if your patient cannot swallow a tablet, if it's too big, maybe they're a kid, maybe they're just not used to it, liquid medications are a great option. But also keep in mind, if your patient cannot swallow at all, the oral route is most likely the most inappropriate route for your patient. So, buccal tablets go between the gums of the upper molars and inside the cheek, whereas sublingual are placed under the tongue and they dissolve in those places. Liquid medications can be given to children until pills can be safely swallowed. As we said before, they're also good for adults who have difficulty swallowing pills. Again, take a look at table 30-7 for examples of liquid medications. Now we're going to learn conversions and measurements. So what you see here on the left is a cup as well as some common measurements that medications are given in, and we will get to that whether it's next week or the week after. Okay? So these medications can be given by mouth or through feeding tubes. Some patients have feeding tubes if they are NPO. Well, some patients have feeding tubes if their gut is not functioning well or parts of their gut are not functioning well. If they're unconscious or in a vegetative state. Medical assistants typically do not administer medications through this route, so that's something to keep in mind. Rectal medications are for patients with GI disturbances who are unconscious or those who are having difficulty swallowing. So let's move on to parenteral routes. Parenteral medications are any medications administered outside of the GI tract. The advantages include rapid absorption and faster response time. So really, there's no absorption as far as intravenous goes. That's available right away. And the absorption through IM or subcutaneous can be quicker than oral as well, depending on the medication. It says absence of side effects, but really any medication that is given into the body comes with its side effects, whether it's given IV, PO. So I can't necessarily say I completely agree with that statement, but it's there. Disadvantages, possible injuries to soft tissue or bone tissue, and rapid onset of allergy symptoms or anaphylaxis. Once you put it in, you cannot take it out if it's injected. So that is something to keep in mind. Sometimes with an oral medication, you can go back in and remove it through absorbers or having the patient vomit, but once you put an IV in or an IV medication in, you cannot take it out. Mucosal membrane medications are used for administering particular types of medications to produce a systemic effect. These can be used like otic ear drops, ophthalmic drops, or eye drops, through the nasal passages or the vaginal area. Those are all mucosal membranes that can absorb medications. Topical applications. These are applied to the skin, and they usually provide a localized action. Medication forms include lotions, liniments, and ointments. And one you might be very familiar with as far as a lotion is, well, actually, let's choose ointments, because usually lotions are more for moisturizing and smelling good. So ointments. Vicks VapoRub is a common ointment that people put on to help clear up chest congestion. Transdermal patches are adhesive patches applied to the skin, and they're usually filled with medication for slow release into the bloodstream. And a great example here would be a fentanyl patch or a nitroglycerin patch, and it delivers the medication through the skin and into the bloodstream. So these are considered systemic. So that covers, I think I said 864 to 876, but I think a lot of that is a couple pages in the back where it's talking about documentation. So those are all routes of administration. Pretty straightforward. You probably had a lot of them yourself if you've been in the hospital at any point in time. As always, if you have any questions, please email me. And otherwise, I'll see you guys next week in week 5.